Welcome! Today, we're diving into a hidden world, a microscopic one, where the tiniest, almost invisible details can mean everything. We're going to explore how artificial intelligence is becoming this incredible, superpowered magnifying glass for the true detectives of the medical world, pathologists. So, right off the bat, I want you to try and put yourself in a pathologist's shoes, just for a second. They spend their days looking at thousands of slides that look just like this one, and somewhere in that sea of cells, a life-changing diagnosis might be hiding in a detail that's literally smaller than a grain of sand.
And we're not talking about just one or two slides. For a single prostate cancer screening, a pathologist might have to meticulously examine 13 different tissue samples. Think about that. 13 different haystacks, and they're looking for that one single needle.
And that, right there, is the human challenge. The sheer volume of work is just massive. It leads to eye strain, to fatigue, and let's be honest, after staring at pink and purple blobs for hours, things can get a little subjective. There's always that risk. That tiny, critical clue might just get overlooked.
So how can we help? Well, that's where our digital detective comes in. But how do you even begin to teach a machine to see with the same expertise as a doctor who's been training for decades? It's a fascinating process, kind of like teaching a person, but you do it with absolutely massive amounts of data.
Let's break down how this works. It's basically a four-step journey. First, those little glass slides get scanned and turned into gigantic digital images. Then comes the really important part, annotation. After that, the AI studies them, and finally, we test it on brand new images it's never seen before.
Okay, so that word annotation, it is absolutely the most crucial step in this whole process. Think of it like a master pathologist sitting down with the AI and pointing everything out. It's like they're taking 30 years of knowledge and carefully, painstakingly explaining it all to the computer. This is the ground truth.
And I mean, they label everything. They are literally drawing boundaries on the image, saying, see this? This is a normal gland. This part over here, that's precancer. And this is cancer. They are creating the ultimate, perfect textbook for the AI to learn from. It's a lot like teaching a child their ABCs over and over and over again.
All right, so the AI has been to school, it's studied its textbook, it's passed its exams. Now what? What can this digital detective actually do to help in a real busy clinic? Well, one of the most common and incredibly time-consuming tasks is checking lymph nodes. Pathologists have to search for tiny, microscopic cancer cells that might have broken off and spread. Finding those is a huge red flag that the disease is advancing. It really is like finding a needle in a haystack.
And this is where the AI's superpower really shines. It can scan that entire massive image in a split second, and it can instantly draw a circle around the tiniest, most suspicious areas. Things that a human eye, especially one that's been working for 7 hours straight, might accidentally miss. It's an incredible safety net. But it's not just about finding things. The AI also brings a new level of objectivity. Take breast cancer, for example. Treatment decisions often depend on scoring something called hormone receptors on the cancer cells. You can think of them like little docking stations. The more docking stations, the better a certain therapy might work. But for a human, estimating that percentage and intensity can be really subjective. Two experts might look at the same slide and come up with slightly different scores.
The AI just cuts right through all that guesswork. It doesn't estimate, it counts. It can count millions of cells, precisely measure the intensity of every single stain, and deliver a consistent, data-driven score every single time. This helps doctors guide treatment with a much higher degree of accuracy.
But, this amazing technology isn't some magic wand you can just wave. It's not a simple plug-and-play solution. There are some really significant challenges and responsibilities that come along with it.
Yeah, putting this tech into practice is a huge deal. The AI is only as good as the data it's trained on, so you need perfect, high-quality images. The scanners themselves are incredibly expensive, and the digital files are so big they require massive servers for storage. And then there's the biggest question of all. We have to be able to understand why the AI made a certain decision. We can't just have a black box making life-or-death recommendations.
And that brings us to the most crucial point of all, and it's one you really have to remember. The AI is a tool, an incredibly powerful one, yes, but it is not a replacement for the doctor. The final call, the final diagnosis, the signature at the bottom of that report, that responsibility always rests with the human expert.
So, keeping those challenges in mind, where is all of this headed? Let's look ahead for a minute, because the future of diagnostics that AI is helping to build is, well, it's pretty revolutionary.
The future isn't just about getting better and faster at finding what's already there. It's about becoming predictive. It's about combining these pathology images with a patient's genetic data, with their radiology scans, with everything we know to see what might happen next.
So I want to leave you with this thought. Imagine a world where, from a single tissue slide, an AI could tell us not only that you have cancer, but also predict its specific genetic mutations without needing slow, expensive tests. A world where we could tailor therapies perfectly to you as an individual from the very first day. That is the promise of AI in pathology, a future that is faster, far more accurate, and more personalized than we ever thought possible.